Diagnostic nasal endoscopy having three passes. First pass is called front to back pass. In this pass, the endoscope is passed along the nasal floor and visualizing the nasal septum and inferior turbinate. In the postnasal space, you can check the Eustachian tube and its orifice and fossa of Rosemuller, and any purulent postnasal drainage can be noted. On withdrawing endoscope during this first pass, you can see inferior meatus, and whenever possible you can see the Eschner's walls, the wall of the nasolacrimal duct. Second pass is called medial to middle terminate pass. In this pass, the endoscope is medial to the middle terminate and you can assess the sphenoethmoid superior terminate and opening of the sphenoid ostium, and you can also check the olfactory cleft more anteriorly, and by angle scope you can check the supreme part of sphenoethmoid recess or floor of the skull base. Third pass, that is called lateral to the middle terminate, or you can say examination of the middle meatus. Retracting, rotating laterally the middle terminate, you can examine the middle meatus area and any discharge from the middle meatus, uncinate process, and hiatus semilunaris. You can see also ethmoid bulla as well as membranous fontanellus and associated accessory ostia. So you can check the OMC in this third pass. On nasal endoscopy, you can classify the nasal septum deviation according to the location. First location may be caudal septum. Second location may be internal nasal wall area, that is the area between the inferior turbinate head, upper lateral cartilage, and the nasal septum, that is the narrowest part of the nasal cavity. Third area may be high mid septum area, or you can say the area of the ethmoid bone. Fourth area may be low mid septum area, or you can say area of the mid boomer bone. And fifth location may be posterior septum area, that is the posterior septal area of the most posterior part of the boomer bone. So this is class 5 according to the location of the septum deviation. According to the severity of the obstruction, you can classify this nasal septum deviation into grade 5. Grade 0 is the no deviation of the nasal septum. Grade 1 is the minimum deviation of the nasal septum. You can see in this picture there is minimum deviation in the grade 1. Grade 2 is less than 50% deviation, or less than 50% is open the nasal cavity, that is grade 2. Grade 3 is the more than 50% of the nasal cavity is the obstruction, is you can see in this picture. Grade 3 there is more than 50% deviation of the nasal septum. And grade 4 is fully lateralized mucosa to mucosa contact. It means lateral and septal mucosa, lateral wall mucosa and septal wall mucosa in the contact. That is called grade 4 deviation of the nasal septum. So this is the classification of the nasal septum deviation.